If everybody can hear us okay, like Bonnie, Madeline, and Roshni, then we can probably begin. I know we'll have a couple more people coming in the room but I'll make sure I mute at that point. So it's great everyone joining. We're fortunate to have a diverse group with us. And I hope you can hear all right. I know that you're doing the background work on that, Ms. Rain, so thank you. We put into the chat box of where you're coming from and what are your global health priorities. Feel free anytime to enter anything into the chat box. We will be checking it out as we go along. And welcome to everyone. Thank you so much for joining us. My name is Kim Peake. I'm with the Interior Health Research Department, and it's our pleasure to co-host this event with the BCCI. And BCI, the British Columbia Coalition Institute, a regional model for the CCGHR. This model focuses on equity-centered practices for connecting knowledge with action using the recently published CCGHR principles for global health research as a framework. Today, the BCI External Consultation Webinar for the CIHR-IDRC Strategic Planning, presented by Nicole Spence and Nazreen Amari. A few housekeeping notes we should mention. The session should run 1 hour. It's booked until 1 p.m., which includes 20 minutes presenting and 20 minutes for Q&A. Oh, sorry, just 2 minutes. I thought we had 60. We'll be recording the session and with you afterwards. If you have any questions during this presentation, please feel free to type them into the chat box in the WebEx control panel. We can bring them up at the end of the presentation, and we'll also have time for questions at the end. Now, turn the mic over to Nicole and Nazreen. Nicole is a program advisor in emergency management with the Provincial Services Health Authority and is the Phase 3 coordinator for BCCI. Nazreen is a research coordinator with the Rural Health Services Research Network of BC at UBC. Both are CCGHR students and young professionals, SYPs, and members of the BCCI Community of Practice. Take it away, ladies.
Thank you, Kim, for the introduction. Can you hear okay? Perfect. Okay. Well, we're really excited to be here and seeing this idea that we had in Kelowna to create a webinar come to reality. So thank you very much, Kim, for hosting us. So the question are we here today? Institutes of Health Research, CIHR, is holding a series of consultations in reference to its global health strategic planning exercise in collaboration with the IDRC. Listed here are the dates of the 4 formal consultations. The aim is to gather diverse perspectives on how Canada can strategically advance global health research and support Canadian efforts to achieve key priorities, including the SDGs. A series of 4 consultations will guide the development of the strategic plan targeting global health challenges for which Canadian strengths can have the greatest impact and guide future partnerships and investments in the field. The strategic plan will be released in the fall. Objectives are listed here and also detailed in that consultation guide that we provided. Essentially, CIHR is looking for investment opportunities at the intersection of what they see as 2 areas, which is starting where we are strong and then building where those priorities are. Context, CIHR invested an average of $30 million annually to global health research. Examples include the Project and Foundation Scheme, which saw $185 million between years of 2000 and 2016. And over that same time frame, the Proven Scheme, which is the focus of these consultations. A quarter of the IDRC funding for global health is done in partnership with CIHR. So you might be wondering, what is CCGHR's role? So given the limited number of experts that were invited to the formal consultations and the specific focus on established experts, CCGHR explored ways to further involve our members. This slide outlines the agreement that we have. Today we are hosting regional external consultation. It is the one in BC. You can see all the proceedings will be entered into a summary report that will be submitted to CIHR-IDRC in May. The session has hosted consultations with members in 6 cities across Canada, including Montreal, Vancouver, everything on this list here. Throughout these, the issue of health impacts of climate change has really come through as a very important issue. So the key outcomes from the in-person sessions in this webinar hopes to reflect the views from across BC, hoping to close these geographical gaps that we have, and specifically reflect the views of the community of practice and its key components, which are SYPs. Here, the May 2nd group, these are most of the people that were there. We did have some people teleconference. Madeline, who's on today, took this photo. These are the people that were consulting and providing the notes that we're working on today. So ultimately, we're here to create a space for those who couldn't have a chance to otherwise contribute. And as a SYP and Nasreen is a SYP, we both know how important that is. And as part of the BCCI Community of Practice, we hope it will be the first in a series that will support continued learning and sharing. So with that, I'll turn it over to Nasreen to jump into the consultation questions.
So for everyone here, I'm hoping everyone can hear me. So for each section, I'll review initial outcomes from external consultation in Vancouver that Nicole just mentioned, and I'll take us some time to explore the questions as a group. And in addition to the discussion, you can provide feedback in the chat, in an email, or in response to the summary documents that we'll be sharing shortly after the session. And so please feel free to send as many notes as you want on the chat while I'm discussing this so that you don't forget any questions you might have. The first questions were median strengths and global health research. And just remember that these are all questions that were provided by CIHR and IDRC, and they were just presented at the consultation. And so the first question that was asked was, what are the strengths in global health research in Canada, both in terms of individual and institutional expertise, whether thematic, methodological, or other? Some of the responses, Nicole, if you can just scroll through so that we can see all of them. No, perfect. So some can read. These are all the responses having at the consultation. Some responded that they felt that Canada that we punched above its weight reviews for individuals, while institutions tend to fall short. Some Canadian Academy of Health Sciences, the consultation was about 5 years ago, and there was a focus on Indigenous and circumpolar health. The CIHR Aboriginal Research Center was mentioned. Strength of technology that was appropriate for resource setting. Mentioned that Canada is strong in population health due to our Ottawa Charter, the 1974, new conceptual approaches to public health, although not always global. Ecosystem approach to health and IDRC's role, linking social and environmental collaboration arising from working with Indigenous communities and the recognition of dynamics. For this section, are there emerging gaps in capacity that need to be addressed through strategic investments? Are there coming areas of importance in global health research where Canada should invest in building capacity? For example, planetary health, integrative health, big science. But the consultation, the participants responded or mentioned the feminist policy, strong research side, the good starts, the second gender-based analysis in population health. Some more work needs to be done. Some intersectional approaches being developed, the extractive sector and its health impact, the health impact of climate change. Like some felt Canada is behind on health technology and big data research. Some mentioned the Ottawa Charter and working on determinants that it is strength, but a gap in implementation science to deliver benefits. As a lack of equity frameworks in emergency management and climate change, and that necessary health should be seen as an upcoming area of strength. Now you've just seen these questions. Are you thinking of anything else that should be added? Or as I'm going through the answers that were provided by the participants, if you can anything else you'd like to add or something you don't agree with, please know through chat, and we'll that we're adding it or feel free to also jump in on the call and let us know what you're thinking. So the tool was also provided as one of the tables allowed at the consultation. And what people responded were for the strengths or expertise relating to Canadian strengths in global health research. They thought individuals work hard to push it forward. And once in the Academy of Health Sciences, there was mentioned the determinants of health, the strong Canadian population health system, upcoming areas of importance of planetary health, and the capacity needs around feminist policy, Renewable Affairs Canada, more sex and gender-based analysis, extractive sector, health technology, climate change, and health impacts. And so at time, maybe I'll just take a few minutes to just ask you all on the line. Thoughts are, is there anything else that should be added that you feel we need to include in this document for this particular section, first relating to the key discussion question or the sub-questions, or would you like this table more?
Is Regina here?
Yes, I can hear you.
Hi, thanks. One of the things that I would like to see listed too, which I'll admit my bias, being involved for so many years, that I think the coalition itself, so the CCGHR, is one of Canada's strengths in global health research. It's, I think, a remarkable resource, a remarkable network. I think our tools and products are incredibly responsive to the needs that have been expressed by our members, but also resonate with people who aren't members of the coalition. And so I really like to see the coalition highlighted as a key strength in Canada, but one that is vulnerable because it's. I would love to see some of the key role that it plays, and the fact that it's a service organization that's not for profit and doesn't have as much core funding as it could have, and it's something I'd like to see more investment.
Perfect.
The suggestion from Bonnie about more research chairs, I also agree with that. Also about capacity needs, I think two small things and then I'll be quiet. One is I think we need more capacity building efforts, of which the coalition has been playing a lead role in doing, but I think we could really scale it up further. Is more training around how to actually work, how to do research knowledge translation from an equity-centered practice. And I think we still have a lot of capacity needs about what when partner in a genuine partnership, what that actually looks like, which ties into the same, that ability to walk or talk about doing equity work.
Does I just read that we also mentioned in the chat capacity needs more funding, and that one with more research chairs. Would like to add anything, or is there anything that has been discussed in the consultation that you disagreed with, or you'd like to add to? If you think, please feel free to also send it in the chat, and we'll make sure to incorporate all these comments into the briefing notes that we will have after this.
Hi, something I think we may want to highlight either later or as an upcoming area of importance. I think youth engagement on global health is key, and just how this consultation was structured just shows that, you know,